because it's 11 o'clock, straight on the nose, and it is being recorded right now. You all should have gotten that message. I just want to start by saying good morning and thank you and welcome to all of you. It's just fabulous to see your faces. I get so excited when I see everybody. It's good. And I'm a complete introvert. So it's been okay being home, but for those of you who really know me, I'm kind of an extroverted introvert. So for me, it's great to see all your faces. I love it. I want to just take a second and just welcome everybody, and we will do a little tutorial, but I wanted to introduce our board to you. Our board is, I'm going to start with Jeff Wiberg, who is the CEO for Family Resource Home Care. He is thank you for waving when you do that, you guys. He is the Washington past president, or WAHCA, with a little help here, with a little helps, past president. No, sorry, he is Family Resource. I know, I just said you're our past president. I didn't mean it, Paul, I promise. So he is the CEO for Family Resource Home Care. He is the past president for the Washington Home Care Association. He sits on the national board for HCAOA, and he serves as our national liaison with HCAOA. And he also sits on the Blooming with the Boomers committee. We also have Andy Niska, who is the vice president and the treasurer of the Washington Home Care Association. He could not be on this call, unfortunately. He had a conflict of, I won't say of interest, he just had a conflict. So we also have Kelda Fairley. I always say her name wrong. I know, don't I? Go ahead, tell us how to say it for real, Kelda.
Kelda Fairley.
Kelda Fairley. Kelda Fairley, she is with Home Care Assistance. She is also the Blooming with the Boomers conference chair. Could we all do this? Snap our fingers a little for her on that. Yay, yeah. And then we have Artie Bindlish. She is Executive Home Care. She is the Washington Home Care Association secretary, and she sits on our Blooming committee. Artie, give us a wave so we can see you, yay. And then we have Charlotte Bodie with Advanced Healthcare. She is one of the co-owners for Advanced Healthcare. She is our legislative chair, and she sits on the Blooming with the Boomers committee as well. We have Tim Cook with Agape In-Home Care, and he is our new member mentor, as well as the Blooming committee. And I would say my midnight, I need some help or a question answered guru. So Tim, give us a little wave there.
Thank you. Hello, everybody. And if you know anybody who's interested in becoming a member of Washington Home Care Association, send them our way. We're welcoming new members, especially at a time like this. Thanks.
Yep, exactly. And then we have Kevin Lamming, who is probably filming this video right as we speak. He is our he is with Visiting Angels. He is our social media wizard, and he is our membership chair. So Kevin, I'm gonna say one thing right now, but you can chime in on this as well. The thing Kevin has been asking me the most, unmute yourself first, so Kevin. The thing Kevin has been asking me for the most is to get our membership to send him clips about what they're doing or pictures that he can post on social media on WAHCA for what everybody's doing, so it doesn't just look like it's a board member social media event, because it's really not. It's really an event. We really want to share everybody's businesses and all the good things that all of you are doing. I also want to point out a couple of other people that are on. Leslie Emmerich, who is she is our lobbyist. Yeah, there's Leslie. Say it again, Les. Say hi.
Hi, everybody. Nice to see you all today.
Leslie does a lot of work for us here in Washington, and she keeps us abreast of all the things that are happening and who we need to talk to. We also have Vicki. Vicki, are you here? Can you talk so I can see you? Vicki with HCAOA. She is the executive director of the Home Care Association of Washington. I'm sorry. I'm getting this all wrong today. Vicki is the executive director, the new executive director for the Home Care Association of America. And I can't say enough good things about all the things she's already done for our membership. And right now, I just want to give her a big round of applause, like, you know, give her this, you guys, because she has really been going above and beyond. She's working a lot of late nights, and oh my God, she took over being executive director during a pandemic. So kudos to her for all she's doing. You know, a couple of things that I want to point out that they've been working on a national level is making sure that home care was in the exemptions, and that we're all considered essential workers. And that, my friends, that alone may have just saved all of our businesses. And I think we need to really understand the gravity of that, the work that they're doing there. They've created a lot of great policy and language for us to use. They have a wonderful resource link on HCAOA. And I would just say that if you are not a member of the Home Care Association of America / Washington Home Care Association, you really want to consider during this time to join. We are together, we are stronger, and I can't say that enough times. Just for clarity, I want to say that the Washington Home Care Association is the state chapter of the Home Care Association of America. So I just want to be really clear about that. And I just realized that I did not introduce myself. I'm Shawn D'Amelio. I'm the Director of Business Development for With a Little Help, and I am the President of the Washington Home Care Association. So we on the state level have also been doing a lot of work just to put together webinars or to put together a WAHCA Latte like this. We also, one of the things that we did was put together a letter that we wrote to the governor, working with him and his, all of our senators and representatives. That's somebody else I'd like to call out right now, which is Kelly. Kelly, where are you? Can you give us a little, she's waving there, she's driving, so we want to keep her safe. She is one of our representatives in Washington, and she owns a Visiting Angels, and we're so grateful to have her on our team right now. She will shoot us emails. She's also working really hard at helping us, because she'll shoot me an email like, what do you see? Did you see this? What do you think about this? And she's trying to get WAHCA involved in the big process. We so appreciate that. When we reached out to our governor, one of the things that we asked him was to make sure that we were essential, make sure that we're getting included in all of the packages that they're putting out financially. Also, we wanted to make sure that we're trying to get on a list for PPE, because right now, hospitals are the priority. I think none of us would disagree that hospitals should have top priority. There's a shortage for PPE. Then it comes skilled nursing, and then communities, and home care is really not on the list. So what we're working to do is get us included in that list when the big shipment does come in, so that we can get it. In the meantime, I do have, I'll put up, I won't do it right this minute, but I will put up a link for the Washington Home Care Association. Has been working directly with one of our Blooming with the Boomers vendors, who has some masks that will be coming in. So they have masks, they have sanitizers, she's working on gloves. So I will put up a link that you can connect with her directly and send out a sheet to you later with that information as well, which we're really excited about that. So as a whole, I just want to say we've been really working hard on a state and federal level to work on behalf of all of you and your home care companies. We know that we're excited, not excited, that was the wrong word. We're grateful that actually the hotbed of the whole COVID virus started here in Washington, because we had everybody landing here full force, helping us get things under control. We have a Governor Inslee, who took action and got us starting to start the process, which has flattened our curve greatly. It's a wonderful thing that, in 8 days, we will probably be reaching our peak of on the use of the resources that we have. So that would be on April 11th. And in the state of Washington, we will have, they're predicting that we will have 0 bed shortages, which is a really amazing thing. We will have 9 ICU bed shortages. We will have, the thing that we are really struggling with are the ventilators, which everybody is struggling with. We will have a shortage of about 280 ventilators. So there's a lot going on right now, but what I know is we are successfully flattening the curve. What I also know is that home care is the single safest method of long-term care right now. And we are going to be in the game. I know that everybody has seen a drop in hours, and that will be interesting to kind of see how that looks. But so I've got all my introductions done. I've done a little leadway there. I want to make sure everybody knows how to send a question in. This is just a little homework here. You have a little chat box down there. You see questions that are popping up on the side of your screen. I want to make sure that everybody is able to see those, and that if you have a question and we haven't answered it, or you want to put a question there to make sure we're trying to address it, Jeff is reading those as we speak, I know. We will work hard on answering those for you today. We're going to also do a couple of polls. So we're going to, let's see, Jeff, maybe you can launch the first poll, the practice poll. Do we have a practice poll that we can do on everybody so everybody can see what that poll looks like? Because we want everybody to participate in these. I can't hear him. He's muted.
That's funny.
I didn't say anything. I just launched the poll, and people are voting.
Oh, good. What's the poll?
So the poll is, what color are Shawn's shoes today?
Okay.
Is it purple, green, tan, black, white, or orange?
Well, anybody who knows me really well will know the answer to that question.
I hope they're purple.
It's gotta be purple.
There a right
See?
answer? I think she's
Feeling
more
it.
thoughts.
I said they were orange to match your sweater and your earring.
Oh, maybe, huh?
All
She is
right.
matchy, isn't she?
Yes.
All right, we'll end in 5, 4, 3, 2, 1. All right, my friends. Looks like 40% said orange is the winner here. And they're orange, of course.
Oh, of course they are.
Of course they are.
Bloomer boots. I knew it. I knew it.
Yeah, you knew it. I told you, anybody that knows me knows that I had my orange boots on. All right, you guys. So I think Jeff, oh, he left us. There he is.
I love those pajama
Saw your
pants, Jeff.
pants, Jeff.
Yeah, they're good.
Yep. Party down below.
I like it.
It's a modern day mullet. Business on top, casual on the bottom.
I'm just happy he's got pants on.
Yes. Yes, me too. Well, so we have a lot of questions that came in, and Jeff and I were talking last night just about, you know, what we're doing to address all of them, and kind of what we're doing to stay sane. And Jeff, what are you doing these days to stay sane?
Great question. So I would say that I try to share something positive with my staff every single day. And then for myself, I'm trying to keep myself positive in this whole thing by avoiding watching news. I'm definitely keeping up to speed and reading news, but I think that watching the talking heads, they tend to spin everything as negatively as possible. And so I just have decided to keep myself away from all of that when possible.
Yeah. Yeah, it's been, I've been baking. So I'm working on that whole COVID-15 thing. I tried out some new bagels the other day. New York style bagels. I've had New York on my mind because they've had a lot of loss, and it's frightening. And at the same time, I just want to make sure we're not forgetting all the loss that we are experiencing in this time. And so that was kind of my shout out to New York, was making homemade bagels. You know, you have to actually boil a bagel to make a bagel. So it was interesting. It was good. And they came out great. So I've been doing a lot of baking and bike riding and trying to stay on top of it and walk away. My husband walks in at 5 o'clock. It's hard when we're all working from home to not stay sitting. Tim's shaking his head because too many times he and I are emailing at midnight. It's hard not to sit at your desk until midnight or 2 in the morning. And I think it's important that we're keeping ourselves rejuvenated, because this is going to be a long road, my friends. This is not going to be something that happens that ends quickly. So we've got to keep ourselves healthy and fit and moving. But my husband walks in at 5 o'clock and he starts saying, hey, it's my time now, 5 o'clock. So it encourages me to turn off my computer and walk away, which is really good.
You know it's getting bad when your pillow becomes part of your home office.
Right.
Shawn, also, for those who've never attended one of the WAHCA Lattes, could you also kind of explain how our format works for WAHCA Lattes?
Yeah, so typically with the WAHCA Latte, we have a focused question. And we meet all over the state. We have it set up all over the state where we're actually meeting in person. And so small groups in person meet, they get to talk about one particular solution. I don't know, did Dexter get on here? Dexter Borby has been kind of leading the charge on WAHCA Lattes. Dexter, speak up if you are on the call. I saw you signed up.
Hi, everybody.
There you are. Hi.
Hi. Yeah, so the idea behind the WAHCA Lattes, we had our first one, I think, late last year. We haven't had a follow-up since. The idea was that as an industry, we would have a roundtable discussion tackling different various topics that are pertinent to us. The first one that we tackled last time was around the caregiver revolving door. And it was very interesting to see how many insights people had into that problem. It's a problem that works, that affects us all. It's very interesting that across 7 different meetings across the state, people came up with, there were similar themes. So it's really a universal topic. So we have about 6 universal topics lined up. But I think in this current situation we're in, I think COVID is a very, very pertinent and important topic for us all to discuss. I would say that this one was, I don't know exactly who, but Shawn and Jeff probably came up with this whole Zoom meeting idea. So I'd like you to know that they get credit for this one. Thank you, Shawn.
Yeah, you bet. You bet. Yeah, thank you, Dexter. And so keep a lookout for those. For the Washington Home Care Association members, we invite all of our members to join in on those lattes, and it's a really great opportunity to collaborate and work together and come up with best practices, which is really important in home care, is that we're all working to and striving to have the best policies and procedures and best practice. So, okay. Jeff, one of the questions, we've had so many questions. One of them is just about how to keep our caregivers engaged. What are you guys doing to keep your caregivers engaged?
Well, a couple of different things. I think that getting information out to your caregivers, especially fact over fiction, is really, really critical during this time. And then I would say that emphasizing good news. So one of our staff members came up with the idea of nominating a home care hero every single week and highlighting a story about a caregiver kind of going above and beyond and popping that out to all of our caregivers, so that folks feel like, yeah, we're still accomplishing our mission. This is who we are. We're getting good things done. Also sharing good news with all of them. And then being extremely informative with as much as we possibly can out there. And we've gotten really good feedback from all of those efforts. I think engagement is really important. But I'm going to flip that back to you, Shawn. What are you doing?
We did something really fabulous yesterday. We had a meeting just like this for our caregivers. And we had 60 people on the call. It was awesome. And the caregivers were very engaged. We did polls on it. We did questions just like this on the side. It was very helpful. And what's helpful too is, and they were all saying, oh, I see, you know, just like we were doing in the beginning of this call, which is, oh, I see Pam. I miss Pam because I see Pam every week at networking meetings, but now I haven't seen her in weeks. And Kelda, you know, and everybody that you normally see, you don't get to see. And you know, it's just making me think, even on the long term, this is something we could really do with or without a pandemic going on, because they want to see each other. They want to communicate and talk to each other, and opening up those doors to do so, I think, is a really great thing. It was, our team as a whole felt like it was incredibly successful. Agree with that, Paul?
Yeah, and I'll just add to that it was very well received. It was our first time doing a big group-wide video conference call, so we were kind of nervous about how it would work, but it did seem to go smooth and was well received. And like Shawn was saying, you know, before this all, we were trying to find out ways to connect with our caregivers more, and even have our caregivers connect possibly in small groups to talk about a particular client issue or things like that. And so I'm assuming like this, you know, using a platform like Zoom, either for company-wide updates or for smaller group conversations, is a great tool. And even separate from talking business, we were also talking about, should we do some sort of fun, more social, you know, social gathering through Zoom with either all the caregivers or caregivers, just as another way to connect, especially during this time where everybody is isolating. So I'm glad we did it. It took a little work to get it set up. I'm sure the second time will be easier, but it was, yeah, well received, and I think it was worth the efforts for sure.
Yeah, thank you, Paul. We did do a little happy hour for Paul's birthday the other night as well, so that kind of worked. Everybody was having a nice toast for his birthday, and it was very fun. Kevin Lamming, what was your idea about, we started doing a video. I did unmute yourself, Kev. I did a little video for a cousin of mine who's just looking for positive comments right now. And I did a little short video, 8 seconds long, on thanking caregivers. And Kevin posted it on social media. And then we kind of started thinking the other day when we were talking about, go ahead, Kev.
No,
Okay. Do you have two things going on there?
I think I do.
Listening to the music.
Can you hear me?
Go ahead, Kevin. We can hear you. I had to mute.
Audio.
It was actually Shawn's feedback that was going through your speaker. So go ahead now. Kevin, you can talk.
All right, can you hear me now?
Yes.
Sorry, my settings were messed up on my MacBook. So sorry about the echo, guys. Yeah, no, having those little video vignettes from Kelda sent one, Andy sent one. If we could all do that, we could definitely put that on our WAHCA page. But more importantly, I feel like it's important for the caregivers to see that we're also in the streets. I've been doing video remotes from me going around, driving around, dropping off gloves and masks to our caregivers and clients to make sure that they know, because if they show up at the office, we have a sign out front that we're not allowing them to come in, but I don't want them to think that, you know, we're quarantined and we can't interact with them. So we still do our social distancing, but it's important for them to know that we're out in the thick of it as well, going out and taking care of our caregivers and our clientele. Hopefully, can you guys hear me still? Oh, okay.
Kevin,
Yeah.
could you just post over in the comments, could you please post your phone number, your text, where you would want people to send you those videos? So if everybody would just do some kind of a little video, and I'll give you a sample of what mine would look like, which is, hi, I'm Shawn D'Amelio from With a Little Help. And I just want to say thank you to all those amazing, dedicated caregivers out there that are providing care and keeping our seniors at home where it's safe. Thanks so much, everyone. Have a great day and stay strong. So it can be that quick, that short, that simple, and just send it over to Kevin in whatever format he puts in the thing. And if anybody else has any suggestions about how you're connecting with your caregivers, please put it in the comments. We will be recording these comments, correct, Jeff? Yeah. So put them in the comments because that's great. And feel free to speak up if you have something quick that you want to say about how you're connecting with your caregivers and what's working, what's not for you. So Jeff, can you talk to us a little bit about the new law that the Congress just passed, and what does phase 3 even mean to us and to home care, and what does that look like for us? What's it look like for home care?
Sure, yeah. So the phase 3, which is called the CARES Act, incidentally, is the one that was most recently passed by Congress. And this one is designed to be kind of some fiscal helps to get the economy up and going again. And it includes a couple of different provisions. So one of which is dealing with loans for businesses to be able to continue payroll. And there's a couple of different ways that you can go about it. There's really low interest loans that the SBA is providing just for continuity of business expenses. But then there's also some incentives for keeping individuals employed if it is that they would have otherwise lost their job due to a significant reduction in your revenues. So actually with that, I'm going to put up a poll that I have. I'm going to call this is called COVID Impact. This will be a confidential poll, but I'm going to launch this poll right now while I'm talking, because there is an issue around this significant impact concept, and in fact, I will also share with you in the news feed This is going to be directly from the IRS FAQ on FFRCA and the CARES Act. So I'm posting up a website that you can go to that has an FAQ document on it. So far nobody's voted in. Are you guys seeing my poll at all?
You have to launch it, Jeff.
No, it's launched. It says attendees are now viewing questions.
No, we can't.
I don't see it.
Huh.
I'm not seeing it either.
All right, let me end that, and then I'm going to relaunch that polling.
Add orange as an option.
Yeah, that's right.
It came up.
All right, there you go. Are you seeing it? Yep, okay, people are voting. So the first concept is significant decline in gross receipts. So right now the IRS is defining a significant decline in gross receipts where your gross receipts for a calendar quarter in 2020 are less than 50% of your gross receipts for the same calendar quarter in 2019. The significant decline in gross receipts ends with the first calendar quarter that follows the first calendar quarter, blah, 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 blah. So you have to pay attention as to whether or not you are having an impact that is significant to your business before you would know whether or not you're eligible to participate in some of these programs. So the news is talking about, hey, there's all these opportunities for businesses that have been negatively impacted by COVID-19. But let's talk about that for just a moment, and the fact that 15% of businesses in Washington State, for example, have been shuttered during this entire time. So they've gone from 100% of revenue down to potentially zero. Restaurants, some hospitality, different locations that are really impacted by COVID-19. And I'm not saying that we as agencies are not being impacted, because you can see by the poll, I don't know if you're seeing the results simultaneous to what I'm seeing, but there are a lot of agencies that are experiencing some reduction in revenue. But unless you are being significantly impacted, you could be exempted from some of the loan forgiveness components of this whole thing. So not saying you can't get a loan to be able to shore up your cash flow during this time, but you may not be able to get the loan forgiveness that they're providing for individuals who are significantly impacted, meaning greater than 50% of reduction of your quarter over quarter revenue figures. So that's an important element to bear in mind. There's been an extension of unemployment benefits. And this is getting a lot of press right now, that the federal government is adding $600 to state unemployment claims. There's a catch though. Right now, the talking heads are not talking about how that is actually calculated. So here in Washington State, we pay unemployment insurance on the first 51,000 and change in our gross payroll, and that funds the unemployment insurance fund that when somebody goes out and says, hey, I'm unemployed for a valid reason, then they would be approved for an unemployment period that can last several months, and they get a weekly check, and that weekly check is derived by an average of their income over a period of about 6 months. They have to have worked over 640 hours in the previous year for your organization, actually as an employee within Washington State, in order to be eligible as well. That rule has been suspended. So more people are eligible in Washington State for an unemployment insurance claim, but it is still using the normal methodology for calculating that weekly check. So under normal circumstances, it's going to be roughly 60% of their average, okay? And then if it's 60% of their average here in Washington State, then they also would potentially get up to 60% of that federal allotment. So they're not getting another $600 on top, which some of our people might look at and be like, man, I'm going to make more money by just staying home. They don't necessarily get the full $600. And so helping our caregivers understand that it has to be a valid claim. So they have to have had a significant reduction in hours, which could be valid. Looking at a couple of folks on this poll that said that they've lost up to 20% of hours, that may have impacted caregivers to where they don't have the availability of work through your agency. So they might be eligible for a legitimate claim. But choosing to stay home because I'm going to collect a bigger paycheck by just taking advantage of this unemployment opportunity is not going to be valid. You as employers have the opportunity to be able to combat those particular claims, and they can get denied at the state level. And if they're denied at the state level, they will automatically be denied at the federal level, because the federal is an add-on to the state benefit. And so getting some of that education out to your caregivers, I think, is really, really critical. So what would be a valid claim during this time? If you have legitimate reduction in hours, it needs to be greater than 25% of their average in order to be a legitimate reduction in hours claim, or if they've been legitimately laid off on account of this whole crisis. And this does include, of course, your office staff if you've furloughed any of those individuals. Another legitimate claim in Washington State is that the rule regarding reasons have been suspended and are including a quarantine period. So if somebody is self-quarantining because they've been exposed and they've actually got some symptoms, and so they're staying home for at least 14 days, that is now being deemed as a legitimate reason for filing an unemployment claim in Washington State. And they would be instantaneously approved, and they do not have to be available for work. So let me talk about that for just a second. If you do have a reduction in hours, and so you're getting a couple of claims from caregivers who otherwise would have been working, and so you approve the claim, but then maybe a week goes by, you start to pick up some additional clients, and so you're calling some of these furloughed caregivers and saying, hey, we've got some shifts for you, and they say, I'm getting a nice paycheck just to sit here at home. You can report that into the ESD, the Employment Security Department, as they are not available for work, and therefore their claim becomes null and void. That again does not apply to somebody who is quarantining. Now, you do have the option, individuals also have the option of filing an unemployment claim in Washington State if they're caring for someone who has COVID-19, if they are securing in place because they're responsible for caring for someone who is a part of a vulnerable population for COVID-19. Those are all valid claims as well. The last one that I would mention, because it's not normal, is if there's no childcare options for an individual, and so they're having to stay home to take care of their children, that would also be considered to be a valid claim under the COVID-19 rules, emergency rules. So these unemployment provisions have been put into play, and then the federal law change has added some additional money for folks to stay home. However, now I'm going to throw in just one more wrinkle into this whole thing, that we are determined to be essential workers. And so that means that we have the ability to deny claims based upon the fact that somebody is an essential worker. So this comes down to a little bit of your own policy. Your own policy could be that you want to grant the use of sick leave, or grant the use of unemployment opportunities to your caregivers as a way to be a good employer. You can also choose to continue them on their average salary, and then hope for some of the salary continuation benefits to be eligible for you. And that's dealing with this law as well. To really understand that well, I really want you to go to the link that I posted, that is the FAQ that is right on the IRS website, so that you can get directly from the IRS exactly what those provisions are and how to calculate it, because it is not simple. And in deciding to take advantage of some of these programs, you are taking on some financial risk that that money would have to be paid back, or that your business is not eligible. So make sure that you're fully understanding that. And I would also recommend that you talk with your CPA regarding that. The last thing I'll talk about in terms of the CARES Act is the availability of some of these loans. The SBA is issuing loans to help defray some of the costs associated with payroll. Those can be forgiven for businesses that continue paying everybody as if there was no reduction in your revenue, but you continue to pay people through the entire period of however long COVID-19 lasts. Those loans that you take in order to fund that may be forgiven if you qualify. And there are size qualifications. So anybody over 500 employees, you won't qualify. There are special rules between 100 and 500 and 100 and 0 that differ from each other. And all of these can be identified on that IRS FAQ website that I posted. And so depending upon who you are as an agency will depend on what rules apply to you. And then also it depends on how much revenue have you lost during this time. And so my guess is that most home care employers will not qualify, because we're able to keep our businesses open. We're an essential employer. And most of us are not experiencing more than 50% reduction in our normal revenue. And so while we're eligible to obtain these loans, we may end up not having those 100% forgiven. And so that's
what does that mean, Jeff? What does that mean when you say they'd be forgiven? What does that mean exactly?
So employers who are choosing to keep employees fully employed and fully benefited and at great expense to themselves are eligible to receive a loan from the federal government through the SBA to offset those cost increases. And then if it is that they were a significantly impacted business, which is defined by the IRS, depending upon your size again, they might forgive that loan. In other words, it would have been free money to utilize to keep your folks employed. How much to pay a caregiver? They would forgive
the whole loan?
The whole loan.
The whole loan.
The whole loan. However, I want to emphasize that it is highly likely that a home care agency will not be eligible for loan forgiveness. So educate yourself, understand how you play into this based upon your size and based upon your financial impact. So again, this website I think has the best information that you can derive some good information on. And there are rules about you can't lay anybody off during this period of time, roughly 8 weeks, I think it is, in order to also qualify. So bear that in mind. If you're interested in having a low interest SBA loan, if nothing else, to just float some of your business expenses, knowing that you may end up actually having to pay that back, they're advising you to go directly to your a chosen financial institution to apply. It is anticipated that that money is going to go fast. So bear that in mind as well. And I will post up here in just a second an FAQ directly on the SBA website that you can learn a little bit more about some of those loans as well. I'm going to share the results to the COVID impact poll, and that I just did right now. So I'm sharing the results so you can see kind of where that is. 2% of us are saying that our hours are up. 17% of us are saying that our hours are about the same. 13% are about 5% or less. 17% between 5 and 10. 26% of us lost between 10 and 20. And then unfortunately, there's 26% of us who have lost more than 20% of our hours. That's definitely indicating some strong impact to our agency owners for sure.
Hey, Jeff, I have a quick question.
Shoot.
Okay. Yeah, it was news to me. Thank you for sharing that information. It was news to me on the quarter-over-quarter calculation, which, as you know, we were just getting started in Q1 last year, meaning, you know, January was $0 revenue. So it's going to be hard to show impact. As far as all the other quarters of the year, if you compare them, yeah, it makes an impact. How much of a stickler are they for new businesses that got started in 2000?
Tim, interestingly enough, they actually do have a question that specifically identifies that particular scenario, in which case they give you an alternate measurement period to compare to. So go to that website again and look for that specific FAQ spot, because I think it'll answer your question.
Fantastic, thanks.
It basically last mid-February to mid-June. End of June, mid-February to end of June of 2019.
Was that a question, Artie?
No, I was answering to Tim's question.
Ah, perfect.
Was there a hand raise or something? I heard a little ping. Did anybody else have a question there for Jeff around that? Please unmute yourself and feel free to ask.
Or throw it in the chat, because getting 80 people to talk all at once might not work. But I'm also, just, you know, I'm throwing up right now the link to the SBA Coronavirus Small Business Guidance Loan Resources page that has some really good information on some of these loan concepts as well.
I was just wondering, once the Zoom meeting is over, are we still going to have access to these links that you're posting in here, or will we get maybe an email with some of those links?
We will post these resources on the WAHCA website.
Thank you so much.
Yeah, you bet.
Well, I'm not a member. Will I still be able to get those?
Yes.
Okay.
Yes,
thank you so much.
Any other questions for Jeff on that? Charlotte, can you talk to us a little bit about caregivers going into the homes and exposure?
Sure. One of the things that we did several weeks ago already was myself and one of our other nursing supervisors, we sat down and actually made like an algorithm flow chart to say, and it was based on what the CDC guidelines are. And so we've been using that to determine who is either a person under investigation, who's someone who's asymptomatic but says they're possibly exposed. And so using those guidelines from the CDC is what we've been using to try to determine what's the best approach. Now, that's not being said that we haven't had caregivers who have just said, you know, I don't want to go to work now because I'm afraid, you know, I'll expose my client. And we've been understanding of that. And I guess from our perspective, wanting to err on the side of caution when we can, because I think, although, I'm a nurse, so I believe in science and trying to use science as much as possible, but there is so much unknown about this specific virus right now also, that I think, wanting to err on the side of safety for both client and caregiver is what we've been trying to do throughout the last several weeks. So that means, having someone who either needs to self-monitor themselves. So that means, they're going to be checking in with us and telling us, they don't have a temperature before they go to work. They don't have any other symptoms of cough or shortness of breath. And then up to the self-quarantine, where someone needs to actually stay home for 14 days until that time. And then they let us know, have they experienced any symptoms? And, are they, and then, okaying them to go back to work into the homes.
Right. So here's a question for you that's come across to me a couple different times, but one is, okay, how many days from symptom-free do they need to be?
So if they had symptoms, it is usually that you either have to have 3 days or 72 hours without a fever, not taking any antipyretics, which is like Tylenol. So not taking any medications and being fever-free, or, between that 2 to 14 days, making sure you're asymptomatic.
Okay. And what about PPE? Caregivers going in with PPE? There's a lot of conversation right now regarding people going in with or without.
Yeah. So currently, and I just looked up the updates again this morning from the CDC. It is still not recommended that if it is asymptomatic and that you have not been exposed, that you do not need to wear PPE. So if you have a client that's been staying home, but the caregiver's afraid because they're just in general have that fear that, is out there. We've been trying to guide them and educate them that, this is, their client hasn't been exposed because they haven't been out. They have not been, around someone who's been COVID positive or showing signs. Then that is still a safe environment. Also letting them know that they need to be monitoring themselves for any types of symptoms and calling the office right away if they're feeling ill in any way, because we also, don't want to put them into a home and want to make sure that, we've given them that 14 days off if they are showing those types of symptoms.
Todd, are you on the line with that Access Care? I thought I saw him sign up today. Jeff, can you tell me, Todd,
Shawn,
are you out there?
No, sorry, this is Dexter. I just wanted to add something to what Charlotte was saying. The CDC guidelines for when somebody can return to work is different from the CDC guidelines for when somebody's considered safe from coronavirus. For patients or clients, what they're indicating is 7 days symptom-free without the use of fever-reducing medications, or symptom-free plus negative COVID tests 2 days in a row for 2 tests. I think there's a more forgiving timeline for caregivers, knowing that there's a shortage right now of care providers, whether it's caregivers, nurses, doctors, and whoever. Just wanted to share that with you in case you also wanted to think about what your guidelines need to be on the patient side. If you have a patient who's coming out of a hospital recovering from COVID, when do you need to not have droplet and contact precautions, right?
Jeff, do you have anything to add to that?
No.
And is there, has anybody started caring for somebody who is COVID positive? Anybody? No?
No, we have not, Shawn. And at this point, you know, unless we can get the proper PPE, I don't think we would be putting ourselves or our caregivers in that situation. At this point in time, that's kind of what we have decided. You know, now if they're coming home from the hospital and they have been asymptomatic, and so they're no longer deemed as someone who is, you know, possibly within that period of infectious, then I think that would be a different case. And so, you know, everything's so fluid right now, and we've been just taking things either case by case or day by day.
Right. Yeah, I put it out there kind of on LinkedIn, which is this concept of BYO PPE, which is bring your own PPE. If somebody's getting discharged from the hospital, I don't think it hurts for the patient to request, because they are the ones that actually have the PPE, even when they're short. Some are not short, a few. But would it be possible to ask them to send home PPE for themselves and a caregiver that would be in need? So it just a thought, if you were getting asked to do an intake or having somebody discharged from the hospital, of asking them to ask that of the hospital. Could they go home with a mask for themselves and a caregiver?
I think you could try to ask. I think that won't hurt at all. But as far as the things that, you know, we've been reading and we've been seeing, they won't do that, because we have actually had conversations with some other home health providers that have connections to hospitals, and they're not even receiving the appropriate PPE from their hospitals either.
From their hospitals, yeah.
So it's going to be a real hard thing to even, you can ask, but I doubt it will happen.
Right. Yeah, it's going to be really challenging.
Shawn, in answer to your question, we have not either, but a little bit less severe than going into a home of a positive is going into a building or a facility where there has been confirmed cases. And I would answer yes to that we have. And I also noticed a question in the side, somebody's been locked out of a facility. So there's a mix of that happening around. We're using the 1 visitor a day rule Inslee put out originally. So we have also experienced caregivers refusing to go into any facility because they heard of what happened at Life Center and they just think that is the worst place to be and they're not taking any chances. We've also had caregivers who, even in the positive cases, are willing to go in because they're taking proper precautions at the facility and the caregiver's properly trained.
And what would you consider properly trained, Tim?
Yeah, well, first of all, their CNA or HCA covers infection control on a regular basis. But then on top of that, and I was going to say, adding on to Jeff's comments earlier about what you're doing with your caregivers, and we're sending out close to daily, kind of every other day, notices with the latest recommendations and the latest trainings. And so we're requiring updates to those infection control trainings. And if anybody on this call has not seen them, if you're a member of HCAOA, you go back in your emails, because HCAOA has been fantastic about sending out free training. Most of the medical and home care.
You got muted, Tim. There you go.
Where did I drop? If you're an HCAOA member, you've seen these free trainings. If you're not, do a little bit of investigation, but we're requiring that updated COVID training as proper training.
Okay, so I have a little message here that says Kelly's iPad raised a hand. So can you unmute her from your side? I'm not seeing it.
Oh, I can unmute.
You're unmuted, Kelly.
All right, thanks. Well, I just wanted to share a little bit on the PPE. So as a state legislator, I was on a call with the Hospital Association on Wednesday. And so this is the association for all hospitals across the state. And their biggest issue is PPE right now. So I posed the question when we're talking about discharges, would you, if you're sending a patient home that's COVID positive, can you send along PPE so that we can get them out of the hospital, free up those beds, provide the care? And they said that they would probably not send somebody along with any additional PPE because they don't have it themselves.
Yep.
So I guess first of all, I should say, you know, I'm here as a visiting angel owner that happens to be a legislator. So I may have, you know, some more information on some things, you know, in regards to my side hustle. But you know, I know that the hospitals are concerned with discharges, and even though the center of this has been focused around the Life Care Center in Kirkland, there are upwards of 90 other facilities that have COVID positive patients. So it's not just limited to the one facility in Kirkland. And so I think we're going to see a lot more positive patients in those buildings.
Mm-hmm. Are you sending, I'm just curious if you're sending your caregivers into those buildings?
We do have some going into, you know, if buildings that have had a positive resident, but we're not caring for those positive residents. We're just taking care of our original clients if they, you know, we've been caring for them all along.
Right.
Yeah.
Again,
So,
going into a facility, a facility is not in itself dangerous. It's,
no.
you know, coming into that close contact and having
Yeah.
that close contact is really where someone is going to have the possibility of an exposure. So if they're going, you know, immediately to their client after they've been screened for the facilities, you know, per the facilities requests, and then they're staying with that client in their room, they shouldn't be having exposure. You know, making sure they're doing their, you know, proper hand sanitation, and also, you know, making sure to scrub down any high touch surfaces, I think is all appropriate things to make sure they're keeping themselves safe.
Right.
Yeah.
One of the questions that we had was, we've been seeing, you know, comments and questions from people about facilities locking them out. We've had a couple cases just recently where facilities have required us to provide our caregiver PPE to go in to care for any client, or our client specifically, even if they don't have PPE or even if they don't have COVID. So I wonder if has anyone else experienced those types of things?
Yes, we have that.
Yes. Yes, us too.
Yes.
Jeff, could you talk a little different about the difference between the masks that you've been doing some research on that? Could you talk to that a little bit?
Yeah, so surgical masks and N95s, that's one of the big questions that everybody has on their mind right now. N95 masks are rated such because they basically filter out anything, 95% of particles that are 0.3 microns or smaller. Of course, this virus is smaller than that, but the virus doesn't travel on its own. It's traveling through water droplets, and there's no water droplets that are that small. And so they're finding that the surgical masks are just as effective at filtering the water droplets as are the N95s. So while N95 masks are more effective for things like chemicals or fumes, things of that nature, they're not necessary for protecting against this particular virus in comparison to the surgical mask. So the difference in cost is about 1/3, and they may be a lot more available. The surgical masks are a lot more available because of a lack of information out there and people being obsessed about the N95 concept. And then I'll also point out that N95s, to be truly effective, need to be fitted. So that's something that people need to bear in mind is that they're actually supposed to be designed for each individual's face. That's because they're designed for things that are more like fumes. So in this case, a surgical mask is recommended and as effective at filtering out water droplets as the N95s.
Right. And I think that's good information, Jeff. I think the other thing that people need to know is that there's a difference between water droplets and aerosolization. So
can you tell us? Yeah.
So if a water droplet could be just, something that would be something bigger, but say someone who's receiving a nebulizer treatment, they could have something that's aerosolized into a smaller particle. A sneeze is actually considered an aerosol because it comes from way deep in the respiratory tract, and so it spews out those much smaller particles. That's why technically they say surgical masks are great if you're working with someone who possibly has exposure, put the mask on them, not on the well person. But like Jeff said, I think there's a lot of research that's still going on out there. And so you're kind of still getting these waffling effects in what they say is safe. But I have been also hearing that, maybe surgical masks can help. I would say it probably can't hurt, but just being careful that you're not around someone if they're sneezing or doing a lot of coughing, trying to stand back and encouraging someone's proper, cough and sneeze hygiene. Hand them a tissue or tell them to cough or sneeze into their sleeve.
There's some questions coming in about the hand-sewn mask, that one of the companies provided hand-sewn mask for all their caregivers along with gloves.
Hey, Shawn.
Yes, Kelly.
This is Kelly again. So I would share that I spoke to Dr. Carlson, who's the Senior Vice President of Multicare, also this week, and his thoughts on prevention and spreading is that, this does spread like the flu with person-to-person contact. And even if you don't have the most, let's say you think an N95 is the most ideal mask, even though a regular surgical mask would be just as effective in this case, if a hand-sewn one is all you have, then that's better than nothing. So I think we're going to find ourselves in a position a lot more that we're just going to have to make do with what we got, and a hand-sewn is going to be better than nothing. I know down here in Pierce County, there's a nonprofit called Step by Step. They help low-income pregnant women with the healthy births of their children, but they've been organizing a massive mask sewing project where they are cutting out masks and giving people out packages that they can take them and sew them back at home. And so they've been just cranking them out. So I know there's a lot of places doing things like that. We had staff here at Visiting Angels sewing masks, and we're encouraging our caregivers to make sure they got at least 2 of those on them so they can wear one day and wash it and wear the next one the next day. On the legislative side of things, I'm hearing from constituents that are working in hospitals that are upset that the hospital doesn't have enough PPE, and the hospitals have had to go to a method of requiring staff to wear it all day long, one mask all day long, because they're just in dire need for more PPE. And again, it's not ideal, but it's better than nothing, and it's what we're dealing with. As the state is put in requests for federal stockpile PPE, the president has said states kind of need to figure things out, and that's where the call from the governor came. If there are any businesses that can switch over and help manufacture some of this stuff, that's what we're going to have to do right now. So I've been putting calls out to my chambers, that manufacturers in the area, that if they are able to switch gears and produce any of this equipment, we're going to have to get to a point in Washington where we are producing some of our own of what we need, because we're not going to be able to fill those supply lines fast enough to get the materials in. And then even when we do have manufacturers, I would be willing to produce stuff. They have to be able to get those supplies as well. I was talking to somebody yesterday that's organizing volunteer seamstresses to sew, and they have more volunteers, but they don't have enough sewing machines. And normally they would go out to somewhere like the Goodwill and obtain sewing machines, and now Goodwill is closed. So you find one path and then you run into a roadblock. So we're just dealing with a lot of this. Bottom line is something's better than nothing.
Yeah.
Kelly, while you're still talking, Kelly, Leslie had a really good question that she posted that you may not have seen.
On the budget?
Yeah, on the budget. Just any comment on that?
Yeah, so we should be having an announcement, today from the governor. Governor needs to either sign the operating budget or veto some things and make cuts. The legislature appropriates funds. It doesn't mean that every department needs to spend every dollar that's appropriated. So we're kind of waiting today to see if the governor is going to go ahead and take some of those steps to reduce some of the spending. And depending on how aggressive he is at doing that, that will impact whether or not we will have a special session, have to go back in and make some of those cuts. I would say that the governor has has the ability to make more precise scalpel-like cuts within the agencies and the departments, whereas when the legislature comes in and does it, it's more of a across-the-board blunt tool. If we went in and said we have reduced revenue and every department needs to cut by 5%, 10%, you lose the ability to incorporate economies of scale, whereas currently the governor does have that tool that can be used. So those things are in play. Our concern about going back into a special session is that we would prefer not to go back into session and have every bill from the last 2 years back in play. That if we went into special session, it would be very well orchestrated, things be negotiated ahead of time, and not come back in for a total rehashing of policy bills on top of the operating budget. At the same time, we're also, I think it's not till 1st of June that we get the next budget forecast. So that's going to come into play, because right now things are so dynamic, up in the air, changing very quickly. We're just not sure how much of a drop in revenue that we're going to see. And so a little more time will help create that picture for us a little bit more to know what we're working with. What else? I got to look at my notes real quick.
So while you're taking a look at the notes, this is probably a good time to remind everyone that in Washington State, the legislature did pass to include home care in the increase for our B&O tax rate to go from 1.5 to 1.8%. And then, we really tried to fight that. And I'm going to guess that there's very little chance that the governor is going to cut that out of the budget at this point, because they're going to need all the revenue they can get. So just be prepared for that starting up July 1.
Yeah, it would be my recommendation that we not have that B&O tax increase, and to don't put that into effect. Obviously the governor wanted it to begin with, so I don't know what decisions he'll be willing to make there that affect small business. Real quick, I was looking back yesterday at the directives that have come from the governor in regards to long-term care facilities, and it did say that the visitors rule didn't apply to end-of-life situations. So I think there may be some room there to, if you have a client that's, let's say, in an assisted living or something and they are on hospice, that you may be able to talk to the directors there and see if you're able to get your caregiver in to go in and take care of that patient. I've been pushing for more clarification since long-term care workers were considered essential. If long-term care workers could go into long-term care settings, and it looks like the latest update that came out this morning said that basically every building could come up with their own sets of requirements on a case-by-case basis.
It would be, is there anything we can do on our side to help encourage them to include us in the language?
You know, initially the governor's office was very responsive last week, not as much this week. And I'm not sure what to expect until they come out with kind of where the budget's going to be. And that might give us some idea of what direction they're going in. It's tough because on one hand, it's like, I want to push to be able to get our caregivers in to take care of those clients. At the same time, it's like, well, how much more exposure do we want? Or do we want to focus on being able to care for our residents in a less congregate setting right now?
Yep. Yep. Which we continue to say, you know, home is the safest place to be. And you know, while I know that we've seen a drop in business, I feel confident that we are also going to, I want to talk about, you know, it's kind of like flattening the curve for home care, right? That right. I think we've flattened the curve a little bit, but I think we will see an uptick in business because people will start leaning more towards home care versus community settings. That's kind of my gut feeling. Does anybody else have a thought on that? Jeff?
Okay. Totally agree.
Yeah.
Yeah, totally agree. Hey, I'd like to see if we could pivot a little bit to some of the questions that were submitted during the registration process, because we're at that time that we wanted to switch over to some Q&A as well. So I've been trying to track which questions kind of got answered through the course of some of our conversation here today. And if you have any additional questions, don't hesitate to post them also in the chat, and Shawn, you can monitor that. So one of the questions that we got are home care agencies included as essential employees? Yes, both at the state level as well as at the federal. Will DOH provide us with templates that we can use if stopped by authorities? So Governor Inslee came out last Monday and issued some guidance along those lines. There is not a need to have any sort of certification or letter or anything of that nature if you're an essential employee. However, the recommendation is that they have some form of identification that they are a home care worker, and then nobody's getting jailed.
Hey, Jeff, shameless plug for membership here. That was actually covered through National HCAOA. They sent out a template that you could have been ahead of the curve, and we did that and supplied our folks. Because sometimes police officers aren't listening to the governor directly, and they just hear something and they'll take action on their own. So
there you go. Good point.
HCAOA National.
Right. And anybody who had I believe that was all included as well in the link that you posted, right? In the materials we posted for the WAHCA webinar.
The HCAOA post that I have, if you scroll up as well, also has that resource that Tim's talking about. So the next question was compliance issues with in-person supervisory visits and plans of care update. Will the DOH allow us to perform over the phone? And what about home safety checks? And if we're late with doing these? So the guidance that we've gotten directly from the DOH thus far is that the process is that they have to make any changes to rules go through a committee that the DOH has that is kind of that command center group. And we've already given that information over of what we're recommending to that command center group. But the DOH hasn't issued new guidance, but with the wink, wink, nudge, nudge, the head of the person who does the surveys said, if you develop your own internal policy that during this time, because of COVID-19, we are adopting the policy of and listed out and how you are going about trying to be as compliant as possible while keeping everyone safe, they're not going to be finding a deficiency on your surveys for those kinds of situations. That being said, we're still trying to codify that. That's under consideration right now by the committee that it has the ability to do that. Next question was, can we conduct orientations over the internet? Are there any ways of conducting skills verifications of candidates remotely? The answer to both of those is yes. So the DOH rules do not specify that you have to do the orientation in person already, so that already exists. And the skills verification is actually somewhat lax, though it is absolutely best practice for us to do skills verification in person and seeing a practical application. A test of a knowledge-based test, like a multiple choice test of what would you do in this particular circumstance, what's the right answer, does suffice to meet those regulations, and those can be done remotely. And then that's not just during this time, that's just in existence overall. Are home care agencies bound by HIPAA? And if so, how and when? So any PHI, so personal health information, is bound by HIPAA. So it's not specific to the business it is, or industry. It is specific to the type of information that we may be in possession of. So the fact that we do have private health information, we are bound by HIPAA. And that is still certainly applicable as well in this case, and something that we'll want to be very, very cautious about. So for example, if you had a caregiver who called in and said, I have symptoms, notifying, yammering around the office or to other caregivers about that fact when they don't have a need to know would be a violation of HIPAA, and you could put yourself into some liability scenarios. The same is also true with clients. So remember that it is on a need to know basis that you're sharing PHI, and especially names. So I'll give you one scenario that this could come up. If you had somebody who was symptomatic and they were exposed to a bunch of caregivers, or a caregiver who was symptomatic that was exposed to a bunch of clients, you would want to say, we believe that there's a possibility that you could have been exposed. We want you to do monitoring for the following symptoms and do so for the next 14 days, which is the CDC guidelines. Excluding the name is how you protect HIPAA. And if, well, which caregiver was it? Unfortunately, I can't tell you that because that's protected information. But the bottom line is that you have been exposed. So those are the kinds of details that you should be cautious about, because at the end of this crisis, there is talk nationally that there's going to be a lot of ambulance chasing and lawsuits flying around of, I got exposed because you put me in harm's way, or, wrongful death suits or things of that nature. So doing everything you possibly can to protect your organization, not just during this time, but for all of the fallout, I'll call it post-apocalyptic fallout, you're going to want to make sure that you're keeping your nose clean on everything you possibly can during this time. Next question was,
This is Kelly. On the lawsuit side of things, this is a major, major concern right now for the hospital association. They're trying to make do with what they have in an emergency situation. This is something that they've tried to pass for many years through legislation. And so I would maybe pose the question to the Home Care Association if they're wanting to get together with any other kind of provider associations that may be interested in seeking the same sort of protections for the steps that you take in an emergency situation.
Yeah, we are, from a national perspective, we're trying, because of the fact that we're now classified as an essential service for healthcare, we're wanting to build in some protections, but they don't exist currently. So it's something that by the way, there's already what's called phase 4 bill in the works in Congress right now. And one of the things that they're trying to attack in that phase 4 is some of the protections for on behalf of all the healthcare workers. And so while we 100% are behind that, we want to protect our healthcare workers, we also need to protect some of our healthcare businesses, and recognizing that there is inherent risks within the process of doing what we're doing. There is also some work being done to try to research if there's any way for caregivers to waive some of their rights of taking action against you as an employer. if it is that you are paying a hazard pay and have ability to do informed consent, where a caregiver knowingly is going into scenarios where they may be exposed to COVID-19, it doesn't negate your workers' comp liability, but it could negate your negligence or other type of lawsuit that could be brought against you by an individual or even by a group of caregivers in class action. In the case that we do end up caring for COVID-19 patients as an industry. Next question, go ahead, Kelly.
Sorry, Jeff. I know that the hazard pay is being thrown out there and conversations are happening, but on the state level, we have hospitals that are in such dire cash flow circumstances right now that they are trying to figure out how they can shut down. And when labor is the biggest part of those budgets, how much more room is there for pay to incentivize workers when we literally just had to infuse some cash into some rural hospitals so they didn't actually close this month.
Yeah, that's an incredibly important issue right now, especially for the rural hospitals or critical access hospitals.
And we're going to see COVID. It's spread to some of our more rural areas. Outside of King, Pierce, and Snohomish counties, and we're going to see a lot more cases in those areas right now. It's going to put even more pressure on those hospitals. So
true. Okay, so the next question is: Are we exempt from the federal paid FMLA and paid sick leave requirements? The answer is yes, we are. That does not bar you from voluntarily complying with the federal rules, which do differ from our state rules. And bear in mind that just because we're exempted at the national level for the national rules, it does not change our obligations under the Paid Family Medical Leave Act here in Washington, as well as the Sick and Safe Leave Act here in Washington. So bear in mind that exemption does not translate across the board there. And even though you are exempt, you can still pay the employees if they would have otherwise been eligible, and you are still eligible for the tax credit, assuming you are otherwise eligible for the tax credits, period. So the answer to those questions are there. Next question I have is, are agencies providing hazard pay? I haven't heard of any agencies yet providing a hazard pay, although I was on a national call this morning with a few agencies that are actively taking COVID-19 patients, and they're doing so with a full PPE get up, and they're charging a premium and therefore paying a premium, but they're not doing it under the provisions of hazard pay. I did some research into it and found that the average hazard pay premium is 10%. Just as a little FYI there, that's the average, which is, I know, surprising, but nonetheless. Are agencies staffing assisted living communities that are known to have COVID-19 cases? And if so, under what circumstances are you doing one-on-one care or facility care? I think that's really up to you as an agency as to what you want to do on those circumstances. I think that you're going to be in a better position to do one-on-one care with somebody who's asymptomatic in a facility using the proper social distancing and PPE standards. But ultimately, kind of like the facilities have their ability to set some of their protocols of what they want to do, you as a home care agency also have that same privilege to decide on exactly what kinds of risks you want to take. My personal opinion, this is, lawyer is I play one on TV, is that you would want to do informed consent, that the caregivers are aware that they're going into a facility that is known to have an active case, that they acknowledge the fact that that is the case, and that they are okay with doing so. And so keeping more communication out there, I think, is going to be super key. And then before you staff a caregiver in that type of a situation, I would also recommend that you screen them for any of the at-risk profile conditions that they may possess, and then decide whether or not that is something that you want to take on, because if a caregiver does contract it and then has a negative outcome, that could become a workers' comp situation for you.
Hey, Jeff.
Uh-huh.
Can you tell us what Access Care put into place for screening your caregivers?
Yeah, and I know that there's several other softwares that are working on something like this, but Access Care was really quick to the market on providing a screening tool where a caregiver can disclose whether they feel like they've been exposed at some point to an active case or whether they are themselves showing any of the following symptoms. And then they can say yes or no before the start of any shift. So you have that documentation constantly flowing in. And it's, if nothing else, even though somebody could technically lie, it definitely shows due diligence, and it shows that you're not being negligent as an agency. And so if your point of care software provider hasn't been talking about doing something of that nature, that is one way that they could support you in making sure that you're not getting caught up in a liability situation.
So you require that every shift that caregiver goes in, they have to self-monitor.
That is correct. Yeah.
And report it through your system.
That is correct. Mm-hmm. And I saw up in the chat feed, there was a couple of other people doing something similar just internally as well. So there's a couple of different ways to skin that cat.
Yeah, I've heard the term called fit for duty.
Yep.
And yes, Jeff, I would, even if you're put pressure on your EMR software provider to get this in your software ASAP, but in the meantime, like Jeff said, do your own internal thing, require them to text you or do something.
Yeah, somebody else suggested up above that they have their caregivers checking in with them every single day and just basically self-reporting fit for duty. Careful on the language. I know Access Care worked directly with Littler to make sure that the languaging was appropriate so that it's compliant with all the necessary rules so that you're not getting yourself into a discriminatory type of a situation as well. The next question here is, caregiver suspects that a client is COVID positive. Can a caregiver call the agency, tell them the risk is too high, leave the scene without the DOH or DSHS or APS, considering an abandonment? We did actually ask that question directly of DOH, and they did say that is something that they would not deem as being patient abandonment. However, there's some gray. It depends upon how reliant a client is on our services in order to be able to stay safe themselves. And so doing your diligence to try to work with family or other EMS personnel to ensure that that particular client is secure is part of your due diligence to avoid the agency being found for patient abandonment. So just some thoughts along those lines, and that came directly from DOH. Potential client being discharged from the hospital has a virus 10 days ago, but the hospital won't test them now because tests are gold. How can they be tested? There is a protocol that the CDC did push out that either you are to be able to be certified as no longer contaminated, you have 2 negative tests 24 hours apart, or there's a certain period of time after all symptoms have abated, including, as Charlotte was talking about earlier, no fever without the use of a fever-reducing medication. That protocol is available on the CDC. I can find it for you and post it. But that is something that you could rely upon as an agency, as a policy, because there's no guarantee that you can necessarily get a client tested for negative. Because tests are so hard to come by at the moment. What are the standards for working with lab-confirmed clients and suspected clients? Are the standards based upon available PPE, or possibly do they have to have a policy not to take them? And obviously you can develop your own policy as an agency as to whether or not you do want to take them. And I did post earlier the protocols that the CDC recommends for caring for a positive COVID-19 patient in the home. So look at that link because it will provide you with some good languaging around some of your own procedures that you can implement as an agency if it is that you are going to choose to provide services to an active COVID-19 patient. Do strictly home care companies have different policies for caring for clients connected to COVID than blended home care and home health companies? The answer to that is most likely. If you're a home health agency providing skilled nursing services, for example, there are some different rules that are coming down from CMS. So that's something that if you're a certified agency, you would want to rely specifically on some of those protocols. As compared to home care, there are not rules done at a national level or at a state level for us to be forced to care for COVID-19 patients. So that is literally up to you as an individual company. And we are out of time, so I'm going to end with a poll. And I'm going to share a kind of a feedback poll. This is just going to have 2 quick questions about these concepts of us getting together as an association, either in specific locations in person. During this particular time, though, is there other ways that you would want us to support you as an association? Do you want more webinar formats? Because this was more of a conversational roundtable type of a thing, but we can also look into doing more webinars. Would that be something that people would enjoy? That's something that we'd love to know. So I'm gonna throw that question up here in just a second. Getting a couple more answers. If I can get just all the votes in on this question here in 5, 3, 1. Thank you. Sorry to.
Good use of prime numbers, Jeff.
I know.
So
here's one more poll that I'd like to throw out there. This is the question on what would you like to see? You can select as many as you want of WAHCA support during the process of this COVID-19 crisis. What can we do as an association to help all of you member agencies out?
do we have the question up there about how often, Jeff? I can't see it on my side. Okay.
That was on the previous poll.
Okay.
Hey guys, can you hear me?
Yes.
We also wanted to talk about the PPE. I know the group wanted to get an order together. And I was wondering, because it's so confusing with Gmail, I just got so inundated with people sending me emails. If everyone could just write me and tell me what they were looking for, I'll compilate all of the masks, the gloves, the hand sanitizer, and then just try to get a purchase order and see how, because Jeff wanted 20,000 masks. That's really going to drop the price for all of us. But the more of us that get together, the better it would be. So if everybody wants to shoot me an email, it's kevinl@visitingangels.com, and just tell me what you need, and then let me put together an order for that lady.
Great. And if you have any suggestions about things that you're doing, please throw them into the comments box. We'll leave that open for a few extra minutes. And I just want to wrap up and say thank you so much. Jeff, did you do all of our polls? Are all of our polls done and live?
I did, yes, thank you. And then I just threw up also the HCOA document resource page that has a lot of this information on it that you can go and collect, because it's going to take us a little bit of time to post up all of the information from today's roundtable onto the WAHCA website as well as our YouTube channel. So just if you need something more expeditiously, feel free to go to the HCOA page.
And please send your videos to Kevin, 10 seconds or less, just thinking and positive, incentivizing things for our caregivers. And the more that we can thank our caregivers and show them gratitude, the better it is. And from all of us on the Washington Home Care Association Board, we want to thank you for joining us today, and we'll look forward to connecting with you next time. So have a great day, everyone, and stay safe. Stay home. Bye.
Thanks, everyone.
Thank you so much. Nice to see you, Sam.
Thank you, Kelly, for everything you're doing for us, Kelly.
Yes, Kelly, thank you. Thanks for joining us.
Amen to that.
Yeah, that was
Bye,
great.
Catherine. It was great seeing you.
I need one of those microphones like Kevin. Those are awesome.
Me too. Me too. Who is that singer, that country western singer that has the microphone on his hand, the old-fashioned microphone?
I don't know.
I don't listen to country.
No, I was doing Zumba before this. Not country's not my thing, girl.
Well, it's
Bye.
so great to see everybody. Bye.
Everybody. Thanks, Kelly.
Yeah. Christina,
Thanks,
next
Deb.
time I want to see your face.
You're welcome.
Shawn Beach, I want to see your face. Ben Solomon.
Where are these people?
I know,
Thanks,
where are
Ben.
you? There we go, Shawn Beach. Hey, how are you? Yeah, nice to see you guys.
Ooh, look
I
at
love
that
it.
mask.
I love your mask.
Yeah,
Yeah,
you too.
mask in the house.
We should take a poll. How many people are wearing pants?
I am. I'm wearing
That'll be our
exercise
next
Zumba
poll.
pants.
That's right. Stephen, thank you for joining us today. We really appreciate you being here with us. Jodelle, nice to see you. Love to see your face next time.
All right, next time I will prepare myself.
Okay.
Thanks for all you
Jared.
do. Have a good day.
Jared, come on, Jared, show us a peek. We need to see
Yeah, where's
those
Jared?
Wiberg boys. Oh, that was a little Jared, little Sweet Home Alabama. I like it.